Thank you to the Wolfeboro Lions Club for underwriting Nutritional Wisdom. The Wolfeboro Lions Club is committed to helping the community with health concerns such as diabetes prevention and preservation of sight and hearing. The Wolfeboro Lions Club meets on the second and fourth Tuesday of the month in the 1812 room at the Wolfeboro Inn. Members of the community are encouraged to attend meetings or visit the website e-clubhouse.org/sites/Wolfeboro for more information.
This is Patty Walker, registered dietitian and certified diabetes educator, and your host for Nutrition Wisdom. Today's show is the second in an episode of an interactive series of diabetes classes. Please be sure to see episode 1 if you haven't already. In this series, I will be using materials from the Diabetes Conversation Maps, which are the same used in many certified diabetes programs. My goal is to provide you with necessary information you need to manage your diabetes from the comfort of your home. Since these classes work best with interaction, I have a few people from the community to be part of our series. Today, I would like to welcome Shelley and Michelle.
Thanks, Patty.
Thank you. You're welcome. Thank you so much for being a part of this and coming in and helping me and the audience learn a little bit more about diabetes. In the first episode, we explained what the definition of diabetes was, the different types of diabetes, some common myths about diabetes, and the feelings that you or your loved ones may have in regards to diabetes. So, and today we're going to continue discussing general topics in regards to the overview of persons with diabetes and what they need to know to help best manage their condition. But before we begin, either one of you have any questions about diabetes, maybe something that was talked about the first episode, or just a question that you might have today?
I was here for your first session, and it was very, very informative. And I think I would just like some additional information on what you can and can't eat. I mean,
we will be talking about that today. Yeah. That's one of the things that we'll be covering.
Great.
So yeah. All right. So as you might remember, I'm using the conversation maps as a tool for our discussion, and I want you to focus on the central top area of the map. It's called the Information Center. And what I'm going to be doing is I have 5 cards. I'm going to be reading these cards. So there are definitions, and the answers are one of the 5 things that are in the information section there. So it could be blood glucose, it could be body fat, it could be the pancreas, it could be the liver, or it could be insulin. So those are the answers. So this is like Jeopardy. The question is, okay. So this organ produces insulin and other hormones.
I'm going to go for pancreas for 10.
Do you want to up that? The pancreas is absolutely correct. The pancreas is the organ that produces insulin. Okay. Also digestive enzymes and other hormones. Okay. The amount of glucose or sugar in your blood is called what?
Blood glucose.
Blood glucose, yes. Excess food and glucose is generally stored as this.
Body fat.
Body fat. The only 2 choices left are going to be insulin and liver, so this may be a little tricky.
Okay.
All right. This organ has many jobs, including making glucose.
Well, insulin's not an organ. So.
All right, I can't trick you.
Guess it's a liver.
It is the liver. But did you know that the liver made glucose?
No. Well,
Yeah.
you kind of alluded to it in the last session.
Yeah.
But no, I had no idea.
Yeah. So each of us stores glycogen, which is a form of carbohydrate that's easily converted to glucose. Mm-hmm. Glycogen is stored mostly in our liver, but also in our muscles for quick energy. And so one of the jobs of the liver is to store glycogen and break it down in times of stress, in times of illness, in times that we forget to eat. The liver is actually in charge of our blood sugar by breaking down the glycogen into glucose.
Wow.
Yeah. Which, by the way, if you're a person with type 2 diabetes, can be part of a contributing factor as to why your blood sugars are high, because your liver continues to break down that glycogen into glucose.
As much as you do what you think you're doing correctly,
Yep.
you sometimes don't have much of a say.
Yeah.
Your liver
So
is-
your liver, yeah. So in the first episode, I talked about one of the underlying causes of type 2 diabetes is insulin resistance, where your body, if you think of insulin as a key that unlocks the cell doors of your cells, your muscles, your fat cells, your organ cells, insulin resistance means that the key doesn't fit into the lock. And there's a reason for that. And the reason, one of the main reasons, is that there's excess fat on top of the cell or organ, in the middle of the cell. It's too much fat. And it's kind of like, if you think of fat like gum in a lock, it's preventing the insulin, which is the key, from unlocking the door. And so your liver happens to be the most insulin resistant organ in the body. So it doesn't know that insulin is trying to open its doors, and without that knowledge, it keeps breaking down the glycogen into glucose, thinking that the blood sugars are low. So it contributes about 25% of your blood sugars come from your liver
Wow.
in type 2 diabetes.
Wow.
Yeah. So this one should not be a problem then. The last question is, a hormone that is needed to move glucose from the bloodstream into the cells to be used for energy is what?
Let's guess.
I'll give it to the nurse.
Insulin.
Insulin, very good. Yes, that is all true. So thank you. I appreciate that. You did a great job with those definitions. But it's important to understand the background as to what is going on and how that all those things interact with each other. Okay? So let's focus on one of the concepts called blood glucose. So if you can look at the top of the school bus down at the bottom of the map there, you're going to see that the glucose, or blood sugar, needs to move into your cells or liver to make to be used as storage or fuel. So too much glucose in your blood can make you feel bad and cause potential long-term complications of diabetes. To feel your best and to lower your risk of long-term complications, it's important to keep your glucose within a target range. Before I share this range, I'd like to ask, do either one of you know what a good fasting blood sugar level range would be for a person without diabetes?
I'm going to say under 100.
Okay.
I'm going to say 80 to 100.
All right. So is 50 an okay number?
I'm going to say no.
Okay, it's under 100.
Ah, okay, okay. So I'm going to say maybe anything between 80 and 100.
Okay, those are absolutely normal blood glucose levels. We actually have two standards. One is by the American Diabetic Association, and they will say 70 to 99 is ideal blood sugars. All of the national areas will agree it's 70 to 99. Okay. And what's a little bit confusing about diabetes is they do keep changing the standards. I think, 80 to 100 used to be a normal blood sugar. 80 to 120 used to be a normal blood sugar. And now anything under 100 is not a normal fasting blood sugar. So as we understand the impact of just even a slight elevation in blood sugar, because if you have prediabetes, you have a double risk for heart disease. You double your risk for heart disease in a pre-diabetic stage. And 90% of the people with prediabetes don't know they have it. So even a small elevation in blood sugar can make a difference.
Okay.
Yeah. So, all right. So 70 to 99 is the ideal fasting blood sugar for a person without diabetes. How about a good fasting blood sugar for a person with diabetes? What number would that be?
Maybe 120 to 100, 120.
Okay. Shelley?
90 to 110.
90 to 110. So you're going in a normal range and slightly above, and you're going slightly above. So this is where individualization does make a difference. So American Diabetic Association will say that it is a fasting blood sugar 90 to 130 is good control.
We're both right, Chelsea.
Yeah, that's good. I like when everyone's a winner. And then there is another organization called the American Association of Clinical Endocrinologists, aka ACE, AACE, and they're going to recommend 70 to 110. So you were absolutely right in getting the numbers closer to a normal range. We certainly want to prevent long-term complications, and these are their recommendations. So that said, if you're a person that comes into my office and your blood sugars have been running in the 300s, getting your fasting blood sugar 70 to 110 is not, I mean, you're going to be having low blood sugars in that range. It's not a goal. It's not the first goal that we would attempt. So individualization of those target ranges sometimes is very important. So we might say, hey, let's get your fastings under 200. Come back in 2 weeks, let's see where they are, and gradually get them down. Other factors that may change your target range would be if you're elderly, if you live alone, if you have other diagnoses. Let's say you have heart disease, or you have you're immobile. So there are other things that we look at, and we actually do individualize the target range. If you're a young person and immobile, we're gonna try to get that 70 to 110 range, that 80 to 110 that Shelley was talking about. But other times it may be let's keep it under 150.
Right.
Yeah. So. Any questions about the target range before we continue?
Yeah, if you are diabetic, and let's say your range is 150 to, for let's say 120 to 150, is your low 100 or is your low 70?
That's a great question. So low, you mean as far as if you can get symptoms of low blood sugars?
Yes.
Okay.
Yes.
So normally a person without diabetes, we're going to say if your blood sugars are under 70, you might have low blood sugars. In a person with diabetes, you could have the symptoms of low blood sugars at 100, at 150 sometimes.
Really?
Or if your blood sugar drops too quickly, you can get symptoms of low blood sugars.
Good to know.
So that is the first thing we try to prevent in diabetes management is low blood sugars. So we have to gradually change those target ranges to get you down there. But it's a question I ask all my clients, is there a level that you don't like your blood sugars to be below? Because the symptoms of low blood sugars are not fun. And that's one of the episodes that we're going to be, I think it's one of our next episodes actually, is the low and the high blood sugars. But low blood sugars come on very suddenly and you don't feel well. And so you want to prevent those.
Right.
Yeah, but you're right. You could actually have symptoms of low blood sugars, and you test your blood sugar and it's 150. You're like, well, it can't be low. It's 150. And it's like, if your blood sugars have been running 300s and 400s, 150 is low for you. Yeah.
Good to know.
Yeah. So sometimes blood sugars can be too high or too low. So what is it called when your blood sugars are low?
It's like a hypo or a hyper or something.
Hypoglycemia is low. So people will say, oh, I feel hypo. And hyper is high. So that's absolutely correct. So as I'd mentioned before, we're going to be talking more about both of these subjects in a future episode. But let's take a look at some things that can affect your blood sugar. So I have these magical cards here, and I'm going to read them out loud, and I want you as a group to tell me, will this make your blood sugar go up or down?
Okay.
Okay? Being sick.
Up.
Ooh, good job. A lot of people say no, it's going to be low because I'm not eating. But being sick, other things cause your blood sugars to go up besides having diabetes. Stress, illness, and infection are all three.
Yep.
So you're going to have higher blood sugars even if you're not eating. And being in the hospital is a perfect way to have high blood sugars. So in the hospital, they actually manage diabetes by insulin injections, because if you have elevated blood sugars, your body doesn't heal as quickly. And so they want to get the blood sugars to a safe level to help you heal so that you can get out of the hospital sooner. So
Yes.
that's something that's very confusing to people that aren't on insulin and they go and they have diabetes and they go to the hospital. It's like, oh, do I have to be on this the rest of my life? And it's like, nope. It's just to manage your blood sugars in the hospital so that you can heal better and quicker.
Okay.
All right. Will this cause high or low? Eating less than usual.
I'm going to go with low.
I'm gonna
Gonna
I
cause.
don't know. I
Okay.
don't know.
Well, it will go low.
Okay.
You know, unless you're sick, of course. But in general, if you eat less, your blood sugar is going to be lower than if you don't. Taking more diabetes than on your plan, more diabetes medication. Excuse me. Do you think it's going to cause your blood sugars to go up or down if you take excess?
Down.
Down. That's correct. So that's where really being able to see if you're on insulin, really being able to see those units on your syringe, or to be able to see the numbers on your pen. You can also hear with the clicks when you dial your pen, but you want to be able to double check that. And you also want to make sure that you're taking the right insulin, because sometimes people are on two different types of insulin, one that causes blood sugars to go down quickly and one that just kind of is background insulin. If you take the wrong insulin, you could get into some serious trouble.
Okay.
So taking more diabetes medication than your plan will usually cause low blood sugars. More physical activity than usual.
Down.
Down is correct. Having a late or skipped meal.
I'm gonna go up as well.
I'm going to say this one I think is tricky. I think the answer in the program is down, because you've delayed your meal, and let's say that you took your insulin, you get a phone call, and you don't get to your food for another half hour, so you've delayed your meal. Sometimes the medication is planned based on the timing of your meal, so it could go down. But again, if you go too long without eating or skip meals, your liver's in charge of your blood sugars and
Right.
can actually cause higher blood sugars. So this is a tricky one, but officially it is down. All right, forgetting to take your diabetes medication.
Increase.
Yeah, you want to take your diabetes medication. Increased stress at work or home.
Increased.
Yeah, stress definitely increases your blood sugar by having your liver break down glycogen into glucose. That's the mechanism. Eating more carbohydrates than usual. Increases, absolutely. If you're on diabetes medicine and you drink alcohol without eating.
Decrease.
I think we stumped Michelle.
I have no idea.
Well, I think in the first episode I talked a little bit about alcohol and drinking alcohol in an empty stomach, and especially if you're on diabetes medicines on an empty stomach, it can cause a low blood sugar. So
Okay.
you want to make sure if you're on diabetes medicine and you drink alcohol to have the alcohol as part of a meal or a snack. And then if you get less activity than usual.
Increase.
Correct. You did well. Good job. Those some of those aren't easy and they're counterintuitive. So that was great. All right. So then we want to continue on. And since we're talking about low and high blood sugars, let's look at some of the signs and symptoms of each. Okay. So again, if we focus on that bus, you're going to see above the bus is some signs and symptoms of high blood sugars above and low blood sugars below. So, Shelley, would you be able to read what it says for high blood sugars? So, above the bus, what are some signs and symptoms of high blood sugars?
So fatigue, blurred vision, thirst, headaches, frequent urination, and mood swings.
Very good. Any questions about that? Have you noticed those, or do you have clients that have those symptoms?
Definitely, the frequent urination is a symptom of family members. Mood swings, absolutely. Headaches, absolutely.
Yeah. Frequent urination is one of the first signs of high blood sugars that I encourage people to be aware of. Thirst, frequent urination, and fatigue are three very, very common signs of diabetes and prediabetes, but people think that they're just getting older or they're on a water pill, so of course I'm going to the bathroom more frequently. Those are important signs to know. And now, below the bus are signs of low blood sugars. And as I say, low blood sugars come on quite quickly. They're not pleasant. And my clients will say they feel like they've been thrown under a bus when they have low blood sugars. So, Michelle, what does it say there as far as the symptoms of low blood sugars?
Shakiness, sweats, headache, mood swings, irritability, confusion, hunger, nausea, and fast heartbeat.
I've had a client who had a rapid heartbeat, and we ask, is it a low blood sugar? And she says, oh no, that's not my sign. That's not my symptom of low blood sugars. I tend to get dizzy and sweaty. And after a trip to the ER to think that she's ruling out a heart attack, it was a low blood sugar episode. So if you have the chance and you do have diabetes and a rapid heartbeat comes on, check your blood sugar. I don't want to dismiss that it's not going to be a heart attack, but it is a symptom of low blood sugars. So, so what types of symptoms have you seen with your clients or family and friends with diabetes? Which ones are more common, the high ones or the low ones?
Well, I'm able to diagnose family members before they are. It is definitely the glazed look.
So is that a high or low you're diagnosing? Okay, you're diagnosing the low ones.
Glazed look, fatigue, irritability, mood swings. I'm able to absolutely diagnose that and tell them, why don't we go take a look at your blood and see what it looks like.
Yeah.
And I'm usually pretty right on.
Yeah, and sometimes it could be 100 and they could still have those symptoms depending on what their normal values are.
Yep.
Yeah. So, and with you, Shelley, you work for the VNA, so what do you see?
Mostly low.
Mostly low.
Yeah.
And that's unfortunately because we're trying to prevent the low. And what's a little confusing too is that the symptoms can be the same for both.
Yeah.
You can have headaches if your blood sugars are high or low. You could be, you could have mood swings if they're high or low. A classic example of low blood sugar is that your inability to think. And so, you're feeling fine, all of a sudden it's like, oh my gosh, you're feeling dizzy, you're sweaty. So you're thinking, okay, I need to go do something. And if you're by yourself, I've had clients who report having family members come home and they're standing in front of the refrigerator with the refrigerator door open, but not able to think what to do next.
Right.
Because the sugar's just not getting into the brain. So it's really important to know all of the symptoms of high and low blood sugars. And as I'd mentioned, that's going to be another episode, and we're going to go over not only review those signs and symptoms, but also the treatment of both what to do if your blood sugars are high and low.
So just a quick question. You'll probably cover this later, but which is worse or which is better, high or low?
So the low we want to prevent because low blood sugars can impair your driving, for instance. All of a sudden you have a low blood sugar, you're at increased risk for not heart attacks, but accidents.
Right.
The high ones, unfortunately, are the ones that cause the long-term complications. So we'll get into those, but that could be anything from blindness to amputations of your foot or your lower legs, to kidney disease, to heart attacks. These are all symptoms of high blood sugars damaging the body over extended periods of time. So they're both bad.
Right.
So it's like pick your poison. But one of the things about if you're frequent low blood sugars, it actually deprives the brain of oxygen, and it does increase your risk for dementia quicker. And so that's one of the long-term side effects of frequent low blood sugar. So you don't want either. So the goal is to kind of keep you in that happy medium, you ride the waves, but stay in a safe place.
And I've got a family member who always gets low blood sugar at night, and thank goodness they're able to wake up and they realize it.
Yeah.
But Why is that?
It's their medication needs to be.
Okay.
They really need to have their medication looked at. So to see a certified diabetes educator, I'm a dietitian that looks at the medications,
Yeah.
but to talk to the doctor about that. And that's another really good important point is if you're having frequent, so I actually tell my clients when I'm trying to get their blood sugars in better control, when they want to get off medications, I say low blood sugars is a good sign. I said, wait, you told me low blood sugars isn't good. I said, yeah, but it means that you're getting better control so we can reduce the medication.
Okay.
Or maybe you can get off this medication. So, I really go over the signs and symptoms and how to treat it, and advise them to call their physician if they're having more than 2 episodes of low blood sugars a week, especially if they're a person with type 2. They need to have some adjustments made, and if they're doing the lifestyle things that we've talked about,
Right.
usually it's medication that can be reduced, which is good.
And that makes sense. If they're changing their lifestyle, it means less medication. More medication, the lower.
Yeah.
It all makes sense.
Yeah, no, I had a woman who was on insulin and she had lost weight and she had high blood sugar, so she goes to her chart and she goes, oh, I need this much insulin to reduce my blood sugars, not taking into account that she'd lost weight, so she actually needed less insulin, and she ended up in the emergency room. It was a very difficult situation. It was winter time. She lived on the bottom of her driveway, sloped down. It was icy. It was just a horrific situation of getting her into the ambulance and getting her to the hospital so she can have IV fluids with dextrose. Yay! Let's get the blood sugar back up quickly. Yeah, but it was a very dangerous situation. Yeah. So lows and highs, very important that you understand the difference. And as I say, some of the symptoms are the same. So what do you think is the way to determine if you're having a low or high blood sugar?
Testing.
Testing is the gold standard. Sometimes you can think back like, gosh, I took my medicine and I forgot to eat. Then it's probably going to be low. Or you just had a large meal and you're getting a headache and you're not on medication, it could be high, so there is some troubleshooting that you can do, but please test. And again, one of the episodes that we're going to have up shortly is all about how to test, how to monitor your blood sugar and what to do with those results, because you want to be the person that's the expert in your diabetes. I mean, that testing is a useful tool for you. It gives you immediate feedback. It is, your doctor and your dietitian, they're going to ask to see your blood sugars, because we can follow trends to see if they're too high or too low. So in the case of the person that has lows every night, thank God that they wake up, because there is a condition called hypoglycemic unawareness where they don't have the symptoms of low blood sugars, and that's really dangerous.
Right.
So I'm glad that they do wake up, but using a monitor is a very, very helpful tool, and what I always tell people, it's just a number. That number is not a judgment of what's going on. It's a number to help us get you in better control, because you want to be in good control to prevent the highs and lows.